A lot of people say, can't you just clean out the arthritis? Remember what I said earlier in one of the other videos, arthritis means the loss of something. It doesn't mean the accumulation of something. So in other words, you're losing the rind on the orange and you can't go back and glue it on, but there's nothing to go in there and like clean off the rust of a hinge and then it works better. So it's the loss of something. So when all surgical or all non-surgical treatment fails, then we start talking about partial and full replacements. I personally think replacement is a misnomer. I think it ought to be called resurfacing, because we're really not cutting your knee out and throwing it away. What we're doing is resurfacing the ends of the bones, just like putting the rind back on an orange. So if only one compartment of your knee, the knee has 3 compartments. It has the inside, the outside, and behind your kneecap part. So if the inside and the outside on the end of your thigh bone and top of your shin bone look good, and it's only behind your kneecap where your arthritis is and you've lost your orange rind, then you can do a partial replacement where you resurface the end of the thigh bone and the back of the kneecap, and that's called the partial. So the rest of your knee is what you were born with, but this is just behind your kneecap. If the kneecap part's good and I've taken it out, but only the inside or the outside's bad, then you can just resurface the inside or the outside. But anytime that 2 of the 3 are bad, then you do the whole thing, and that's what's called a knee replacement, which I think should be called knee resurfacing, because we're only shaving about 6 or 8 millimeters of bone off the bones to cap them with metal. Then we balance the ligaments, we put a piece of plastic in between the metal, and then your new knee, your muscles and your tendons work the new knee just like it did your old one that had no cartilage left on the ends of the bones. You can rotate, you can bend and flex, and again you put a little plastic behind the kneecap and it rubs on the metal. So a full knee replacement is like a full knee resurfacing.